Good morning, everyone. My name is Ron Halber, and I am the Executive Director of the Jewish Community Relations Council of Greater Washington. The JCRC serves as the public affairs and community relations arm of the organized Jewish community in our nation's capital. We represent more than 100 organizations and synagogues throughout the region, and a key component of our work is empowering, training, and mobilizing our community to engage with and advocate for the State of Israel. Thank you to the more than 200 people, and we may even end up with more the way the numbers are climbing. Thank you to the more than 200 people from our region, Israel, and throughout the country who are joining us for today's webinar. And I'd like to thank Alexis Schwartz and Adam Odesser, JCRC's Israel Action Center Director and Associate, respectively, for arranging this webinar. We are now almost a year into the COVID-19 pandemic, and Israel is leading the world in vaccinations, having vaccinated more than 4 million of its 9 million citizens. And as a Jew and as a Zionist, I have to say I'm very proud. I would like to welcome Director of the National Center for Infection Control of the Israeli Ministry of Health, Dr. Mitch Schwaber, a former Bostonian, who will speak to us about Israel's response to the pandemic and vaccination rollout. Dr. Schwaber is an expert in infectious diseases and a practitioner of internal and infectious disease medicines at Tel Aviv's Sourasky Medical Center and Maccabi Health Services. He's also a professor of medicine at the Sackler Faculty of Medicine at Tel Aviv University and is a reserve officer in the Medical Corps of the Israeli Defense Forces. Dr. Schwaber serves as an advisor to the World Health Organization and was recently appointed to co-chair the WHO's Infectious Prevention and Control Guidelines Development Group. Dr. Schwaber will start with an overview of Israel's response to the pandemic and vaccine rollout. I will then follow with several additional questions. And for the last half or so, we will take audience questions. Several of our viewers today have submitted questions in advance, but if you have a question at any point, please feel free to use the question and answer feature found at the bottom of our screen to send them in, and I'll try to get to as many as possible, I promise. Before we begin, I'd like to note that several of our viewers have asked questions about Israel's providing assistance to the Palestinian Authority with its vaccine rollout. Our speaker is not involved in the government's decision-making on this issue and has no knowledge to address to what extent Israel is being involved with the Palestinian Authority's vaccination plans. We will be sharing some documents in the chat which explains Israel's role in addressing the Palestinian vaccination and the steps the Israeli government has taken, which I hope will answer your questions. Part of what was in the news yesterday is that Israel's already provided 5,000 dosages for medical workers in the Palestinian territories. Dr. Schwaber, thank you for joining us today. If you told everybody about your local family, I think you'd find that a lot of people here know your brother. And I would like to also take this opportunity to thank you and all of your fellow healthcare workers and first responders, your heroes in Israel and around the world, for all the life-saving work that you continue to do every single day. I will now pass it on to you. And once again, thank you for being here with us.
Thank you very much, Ron, and thanks to Adam and to the rest of your staff who've worked behind the scenes tirelessly to put this together. It's a real honor to be here today. And since you already started, I'll give a shout out to my brother and sister-in-law, Jeff Schwaber and Liz Schreier, and they are a great family hailing from Rockville, Maryland, and DC, who I believe are online today as well. So I'll start, as you said, with, I'm going to try to share my screen here and put up some slides, because I think it'll help to, if you can see what I'm describing, that'll make it easier to follow. Can you see? Is my screen being effectively shared?
You're all set.
Okay, excellent. Okay, so we'll jump right into I gotta say, this was a clever title that you came up with, Vaccination and Israel's COVID-19 pandemic response. So just a little bit of background. The population of Israel is about 9.3 million. The Ministry of Health is the central regulatory health body. It's led by the health minister, who is a political appointee of the prime minister. And there's a professional staff under the director general, who is appointed by the minister. And the health ministry has jurisdiction over all healthcare institutions in the country. And it formulates vaccination policy and regulates distribution of vaccination. Israel has universal healthcare coverage for all citizens. From the get-go, it was, if you will, Obamacare here, actually even before statehood. And all citizens belong to one of four health funds, which are known in Hebrew as Kupot Cholim. So the highlights of the pandemic from the beginning are sort of shown on this chart. There have been three waves of infection. The first one, when we first started, has subsequently been dwarfed by the next two. A total of over 670,000 people have been infected as of this morning. And that's 7% of our population, and just under 5,000 deaths, which is 0.7% of those infected. So you can sort of see the timeline of the waves, and we'll talk a little bit more detail into that. So just some highlights. The timeline for the first wave, we began preparing for this before it hit, because we were following what was going on in China on the Far East. And so we began preparing the health system and the health funds and the hospitals already in January. In January 30th, sky closings began. And our first confirmed case was on February 21st, a returning passenger from the Diamond Princess cruise ship. On March 10th, the government began imposing restrictions on movement, and there were progressive orders for venue closings and movement limitations. Schools were closed on March 13th, and on March 19th, a national state of emergency shelter in place was declared. Our first death was on March 20th. Okay, went backwards here, okay. In March 25th, the ministry ordered that all comers to healthcare facilities must wear masks. This was far before much of the Western world was already masked. And it wasn't just medical staff, and it wasn't just medical staff taking care of corona patients. Everybody, all comers, patients, staff, visitors to healthcare facilities, as of March 25th, had to wear masks. A week later, that was extended to masks in the general public as well, initially as a recommendation and ultimately as law. So for the first half of April, we started to have partial nationwide lockdowns corresponding with holidays where people traditionally moved around and gathered. As I mentioned, April 1st, the Prime Minister took to the airwaves and urged the public to wear masks outside, and that would become law as of April 12th. And again, we were one of the first countries in the West to do that. This is what our lockdown looked like in April. Okay, these are Jerusalem, Tel Aviv, Beersheba, Kiryat Shmona, empty streets, empty big major thoroughfares emptied of people. Here's another picture from 2 days before that, and even later on in the month when we were still under restrictions. Here's a political rally. So political rally was allowed to take place, but you can see that people are all masked, and there's an effort made at maintaining distance, and it's outdoors. So this was a very drastic move, and it worked. And by early May, our first wave was effectively quelled. And the Prime Minister took to the airwaves and urged the people to go out and enjoy their newfound freedom. But it was newfound freedom, but the virus was still among us. And this is what May looked like in Israel, a far cry from what we saw in the pictures from April. This is, pubs, people gathering, you don't see masks, nightlife. This is day life on the beach, lots of gathering and not a mask to be seen. And so it was really just a matter of time. The schools came back into operation in May, but with the virus still among us, it was inevitable that we were going to see a new surge in cases. And by the end of May, around the time of the Shavuot holiday, we started to see a rise in cases. This is an article that was published in the medical literature talking about a large outbreak in a Jerusalem high school 10 days after the schools reopened. What it says here is testing of the school community revealed 153 students and 25 staff members who were COVID positive. This is what's known as a super spreading event. So here we are at the end of May, early June, and then we basically reach a plateau in the summer months where we're not going up effectively, we're not going down effectively. And then the academic year starts. Schools reopen on September 1st. And basically, the summer break ends for everybody. And sure enough, a big uptick in cases, a second wave. And that prompts the government at the time of the fall holiday period, really just before Rosh Hashanah, to declare a second lockdown. And that's intensified just before Yom Kippur and continues throughout the holidays. And that works and brings us down effectively by the end of October throughout November, we're in a relative lull. Again, it's not the same lull as May, but a relative lull until in December, we start to see a new uptick in cases. And that has led to the need for a third lockdown, which, like the second one, was intensified in the course of it. And here, unfortunately, despite the lockdown measures, the cases are not declining as rapidly as hoped. They're just sort of beginning to inch their way down, and we're not even sure that's going to be maintained. And there's a number of reasons for that. Among them is insufficient compliance. Our streets don't look like what they did, like the pictures I showed you in the first lockdown, and inadequate enforcement, and also arrival on our shores of at least two of the variants of concern, what are known in the popular press as the mutant strains. The British mutant strain, the South African mutant strain, have been identified here, and they are changing the epidemiology of this outbreak and spreading very effectively. So at this point, I'm going to talk from here on in about the vaccine rollout, because Israel has been long in gearing up for the distribution of the vaccines when they become available. By way of background, I just want to show how our outbreak looked by age groups. If you look at the distribution of illness by age, so this is sort of a pyramid starting from age 0 and going up to age above 90, decade by decade, men in blue, women in green, and can see that it's very bottom heavy. The bulk of illness was in the younger population. People 60 and over made only 11.4% to date of the people who got the illness here. But if you look at the deaths by age group, built similarly, you can see that the pyramid shifted. And here, the 60 and up age group are responsible for 92.5% of the deaths. So this clearly informed the decision makers when they made their priority lists for vaccination. So there have been 2 vaccines approved for use in Israel. I put their scientific medical names, but they're colloquially known as the Pfizer vaccine and the Moderna vaccine. These are both mRNA vaccines, vaccines based on the same technology, each one given as a 2-dose, two-dose vaccine. The Pfizer one is given at a 3-week interval and the Moderna at a 4-week interval. Mostly, the bulk of what we've used to date is the Pfizer vaccine. Moderna, we've had a limited number that's arrived so far, initially earmarked for housebound people who can't arrive at the vaccine stations, and also in some cases for soldiers. More Moderna doses are expected in the coming months. So in November 2020, before the vaccines were approved, the Ministry of Health appointed a vaccine advisory subcommittee to set guidelines and the priority groups for vaccination. And they put out a list. It has been updated several times since the list was first issued, but medical staff were at the top of the list and a certain quantity earmarked to the essential security services. And then pretty much what you would expect to see on the list of priority: residents and caregivers in long-term care and nursing homes, assisted living, psychiatric facilities, those over 60. As more vaccines became available, we were able to gradually decrease the minimum age, even going as low as 30 and over. The severely immunosuppressed, the household members of the severely immunosuppressed, the severely compromised pulmonary reserve patients, patients on dialysis, caretakers of the elderly, burial workers for deceased corona patients, prison services, the staff and the inmates. More recent arrival on the list are pregnant women, when we've seen several serious cases with the new variant among pregnant women. educational staff. Recently, 11th and 12th graders were put onto the list in order to be able to get them into their national exams before the end of the year. And additional medical risk groups. But before we even got around to the additional medical risk groups, the government decided as of yesterday to open up vaccination to the general population age 16 and over. The Moderna vaccination is for 18 and up. Pfizer is for 16 and up. So right now, as of today, as of yesterday, everybody 16 and up is eligible to sign up and come get vaccinated. The rollout began on December 19th, Saturday night. The Prime Minister took to the airwaves on primetime TV. He had his personal physician administer him the vaccination. Right afterwards, the health minister got his vaccination and a few other higher ups. What you might know is that those with keen eyes, aside from the fact that the Prime Minister isn't masked, but it's an election season, that contrary to a lot of the pictures that you're seeing of vaccinations around the world, neither the physician nor the nurse are wearing gloves. That's because there's no need to wear gloves. There's a need for proper hand hygiene, but not gloves. And we have been very actively propagating the message that proper hand hygiene is required, gloves are not. And those who use gloves to give vaccinations still have to perform proper hand hygiene. So this is what a health fund vaccination site looks like. This is the individual station where the patient comes to sit and gets the vaccination. All of the relevant equipment for skin prep and for vaccination and for safe disposal of needles are there for cleaning up the area afterwards. And there's a computer in order to enter the information and document in the patient's online medical record in real time. This is what a health fund site looks like. This is several stations. Each one has people getting vaccinated. This is converted for this use only. It's not being used for anything else at the moment. This is a site for vaccinations at a hospital. Many of the hospitals were also administering vaccinations to their own staff, patients, and sometimes the general public. You can see here the vaccinations are administered behind these barriers, and there's a big waiting area for people to be socially distanced as they wait their turn and also before discharge, so they can pass their required 15-minute waiting period at the end of vaccination before leaving while they're effectively socially distanced. We have vaccinated the foreign diplomatic corps here, so we have some appreciative tweets. This is from the ambassador from Thailand and the ambassador from Norway. And here's a shout out to my wife, who is a nurse midwife at one of the health funds, giving one of the several hundreds of the vaccinations that she's administered to date. So what is our vaccination status? This is as of today, this is late breaking news as of 10:30 this morning, total number of vaccinated, and this is divided into dark green is the first dose and light green is the second dose. Again, the lion's share are getting Pfizer, so the second dose is 3 weeks away from the first. This is the percent of the population vaccinated first and second dose. At this point, 35% of the population has received at least the first dose, and about 20%, just over 20% has received the second dose. And everybody who gets the first dose is earmarked at the time for the second dose. This is the daily number of people vaccinated, again, with the first and second doses. You can see at our peak, we were well over 200,000 a day. Those numbers have tailed off, but hopefully with the recent expansion of eligibility for all 16 and up, we would like to see an uptick in the coming days. And this is the percentage of each age group vaccinated. So you can see that in the age 60 and up, which identified early on as the highest risk for mortality age group, we're well over 70%, and for the 70 and up, we're well over 80% vaccinated, and clearly pushing to get as close as possible to 100% for the entire eligible population, but particularly for the high-risk groups. This is Israel compared with other countries, the share of people who received at least one dose as of yesterday. You can see that Israel is leading the world in that regard, and a number of other countries on the chart. So finally, before closing, how have we done it? The Jerusalem Post put out an article by Mayan Jaffe Hoffman earlier this month, last month, 9 reasons why Israel leads the world in vaccine distribution. Going through the 9 reasons, first of all, as I said, we have universal health care, so everybody's covered, and the health funds are responsible for vaccinating their own people who they insure. People have trust in their health funds, so they feel that they're in good hands when they go to get vaccinated, and they have who to turn to for any questions or issues. There's a big focus in Israel on preventative care, and it's something that's given a lot of priority by elected officials and by the health funds and by public health officials. Israel knows emergencies. Unfortunately, as you all know, we're well versed in responding to emergencies and emergencies to the public safety and welfare. They've often been terror emergencies, but in this case, it's a public health emergency, but we know the drill. We know how to rally our forces when it's personal security and not national security. A lot of the responses are draw on similar resources. There are a lot of people who work for the health funds, so there has been no shortage of manpower. And in many cases, we've seen people who are retired coming back and volunteering time in order to help with the vaccine effort. This is not the first time the health funds have vaccinated many people. We've had measles vaccine campaigns, we've had polio vaccine campaigns, and every year we have a national flu vaccination campaign. So we've done this before, and we know how to make it work. There's been a big emphasis on data and technology, computerized medical records, as you saw in the picture I brought out of showing that the patient's card is swiped as he or she comes to get vaccinated. It all goes into their medical record. When they complete the 2 vaccinations, a form is generated documenting the fact that they've been vaccinated with the dose number. There's been a very proactive communication. The airwaves and in mainstream media and social media have been filled with well-known, well-respected health figures, doctors, nurses, taking to the airwaves and promoting the vaccination, answering questions, talking about how effective and how safe the available vaccines are, and really taking on the anti-vaxxers, such as they have been, and debunking the myths that they have been trying to disseminate. And finally, Mayan Jaffe Hoffman lists the spirit of the people, health professionals, and the general public, just really being ready for this and eager and excited and spirited to bring it out. As one of the health fund officers said, we really, really feel the public was waiting for this, like a hope that is coming true. So we've had several moments of light in the midst of a year of a lot of darkness. This is one of them from early on in the pandemic, captured by CNN. With that, I will say thank you very much for your attention, and I'm happy to take questions. I'll just unshare my screen here.
Dr. Schwaber, thank you very much for that very well laid out, clear, and easy to understand presentation. For those of us who are not in the medical field, I think it made it a very compelling, well-structured, and clear to understand presentation. Thank you. So we're getting a lot of questions, so I'm just going to shoot all over the place and throw them at you. One is, this is coming from the other side, from our friend Margot Wolfson. Can you ask Dr. Schwaber if they know any more than the U.S. about possibly who should not be vaccinated? And number 2, what is going on as far as the monitoring of side effects?
So it's an excellent question, very pertinent. It actually, the 2 vaccines that have been approved here, which are the same 2 vaccines that are approved in the States and in use in the States, are happily not only highly effective, 94 to 95% effective, but they are also exceedingly safe. There are very, very few serious side effects, so that the actual contraindications to getting this vaccine, either one of them, are very, very few. You have to have a severely life-threatening or anaphylactic reaction to a component of the vaccine.
Does that mean allergic, by the way?
Allergic, but not just any allergic reaction, a life-threatening allergic reaction,
okay.
Immediate life-threatening allergic reaction to one of the components of the vaccine, or to multiple injection drugs, meaning you've had this type of life-threatening allergic reaction to multiple different injections that you've gotten in your lifetime.
All right, so give me some advice to the person out there who's sitting at home saying, "Oh my God, I've had all these allergies. What kind of allergies what should I be concerned? What allergies if I have should make me concerned about taking the vaccine?"
So really, it's really a non-allergenic vaccine, and so that even people who have life-threatening allergies to food, to bee stings, to penicillin, that is not a contraindication to get the shot. For certain life-threatening allergies that are not contraindications, we recommend, instead of the usual 15-minute observation period afterwards, 30 minutes of observation. For people who walk around with an EpiPen because they may be prone to life-threatening allergic reaction, to take their EpiPen with them to the vaccine stop, and to make sure all of our vaccination venues have medical teams on hand who are prepared to and trained with the proper equipment to do life-saving support. I don't know if that's true every place in the state. So I would say, if there's somebody who has a history of life-threatening allergies, it would probably be sound to get vaccinated at a place where there are medical staff and equipment to respond in need of an emergency. And if there's any question, consult with an allergist. But don't assume that because you've had an allergy, you cannot get the shot. In almost every case, even with your history of allergies, you still can and should get the shot.
Good. And what about monitoring the side effects? Like, what have we seen? Because Israel's already obviously vaccinated so many millions of people. You obviously have a large enough data sample to see, right, probably in the following weeks, at least over a month or two period, if there's been any side effects. Anything coming up?
Yeah, so sure, there's side effects. There's no free lunch. Everything, I can give you a few trends with side effects. First of all, the good news is that the side effects are generally mild and they're generally short-lived. Now, and the other generalities, of course, every case is individual, but the other generalities is that there seem to be more associated with the second dose than with the first, and more with the younger population than the older population. The types of side effects, the most common would be just soreness at the vaccination site. In some cases, there have been reports of headache, of chills, even fever. And in some cases, like tingling. Again, typically, these are short-lived, resolving within 48 hours. And in some cases, you can take Tylenol if you're uncomfortable, and that has provided relief. It's rare that it requires medical attention. And even when it has required medical attention, in almost every case, it does not become a contraindication to get the second dose if it happens after the first.
Right. Another question. I'm try to wrap up some questions together. Impact of vaccine and what about pregnant women in the vaccine? You also talked about that for a moment in your presentation, and some pregnant women are concerned about taking the vaccine and whether it would have an impact on their child themselves. Can you elaborate a little bit about that?
Sure. I mean, these are very, very hot questions, and they're naturally coming up because the big trials didn't have women who knew they were pregnant at the time of enrollment. They didn't enroll them. So there's not a huge amount of data on pregnant women having been vaccinated. That data is being generated now as the vaccine is being rolled out around the world. But I can say this. Even though it's the first time this technology has been used in human vaccination, it's a technology that has been around for 10 years. There's a lot of data that's been generated in the lab and in animal studies on it. And there's nothing about the technology that would make one suspect potential harm to a pregnant woman or to her fetus. What the Israeli health authorities have said is any pregnant woman who wants to get the vaccine may get it. Pregnant women who are in risk groups because they have other illnesses or they're in the healthcare field are recommended to get it. Women who are planning pregnancy but not at the moment pregnant are advised to complete the vaccine before getting pregnant, but then they don't have to delay getting pregnant.
Have babies been born with COVID when they are found afterwards from their moms having been infected?
So that's happened. That's not the rule, but apparently has happened. But there's also reports, some coming out very recently, that a pregnant mother may transmit protective antibodies to her baby.
Yeah.
The one area where we hedge a little bit, and I'll tell you why we hedge, is women in their first trimester. Women in their first trimester, the first trimester of pregnancy is fraught with a lot of potential stop and starts, issues that may come up that until we're through with the first trimester, we're not necessarily on a smooth road. So in order, we recommend to women who are in their first trimester, if you're in a risk group, get vaccinated. If you want to get vaccinated, get vaccinated. If you're not in a risk group and you're capable of protecting yourself from infection until your second trimester, you may wait until your second trimester, just not to muddy the waters. If you have a reaction to the vaccine or something that's going on with the pregnancy, not to confuse and be uncertain what's if one is causing the other. But what we can clearly say is that the pregnant women are at risk for severe illness should they become infected with the coronavirus. And with the new variants, the new mutants, that is even more pronounced than it was with the older variants of this virus. So it is definitely safer for a pregnant woman to be protected from the virus than to get infected with the virus.
Thank you very much. A couple more questions combined. How is Israel dealing with the refusal of many in the Haredi community to take the vaccine, and also the same problem among Israel's Arab population?
Yeah, so first of all, I don't know that they're the same. I'm not sure that there's a lot of refusal among the Haredi community to take the vaccination.
That is the perception. That is the perception, by the way, in the United States from the media.
Right. There is some element of that, and there certainly is in many Arab communities reluctance, hesitancy to get the vaccination, and the answer is just education. Part of it, when you look at the percentages of vaccinated, you also have to look at percentages of people who've had the virus. There's a high percentages relative to Israeli society in general of Haredim and of Arabs who have been ill with the virus and recovered, and those at the moment are not being vaccinated by Israeli policy because they're considered protected. So if you look at just pure vaccine uptake without taking account of the percentages in those communities who've already been ill, you might get a lower than real picture. But of people who are immune to the virus by virtue of illness or vaccination. The answer to reluctance to get vaccinated is education and more education and outreach. And many of my colleagues and really the whole public health services are out there all the time answering questions, allaying concerns. People who know somebody who knows me are reaching me and asking, well, I just have a question for a friend about, I'm a little bit nervous because I had a bad reaction at one point to this, or I'm considering getting pregnant, or a million and one different scenarios. And it's really just a matter of answering the questions, giving the information that we have, and encouraging anybody who doesn't have a contraindication to get the vaccine.
So I've been actually myself have been involved as the CRC director, and a lot of groups have been reaching out to me for questions and answers because in the United States we have we have a very decentralized process in terms of giving out the vaccines, and I'm just one. And to be honest, in Montgomery County right now, I would think many people would consider it chaotic. To be honest with you, and I think that's a fair assessment of Montgomery County. What are some quick lessons that I mean, obviously, as a small country, it's no longer than 6 hours from one area to any other in the country. But what are the? Can you give me like 2 or 3 things that if you were speaking to, your American medical counterparts, they could do immediately to improve the distribution of vaccines in the United States? What would you say? These are 3 things you got to do to make sure that the United States is doing a better job than we are now.
Well, I think that every provider in Israel, the healthcare provider in the community is one of the health funds. So I think that they're the insurer and they're the provider. And I think every healthcare provider has to work out the logistical infrastructure to deliver the vaccine to all of those insured by it. In Israel, we have that infrastructure set up, and we're seasoned at giving vaccinations. But I think that's the level. Again, I'm not as familiar with as I am with the Israeli system, with the U.S. system of distribution. But in the U.S., there are also providers. There are insurers and who have who cover patients in larger insurers, smaller insurers, and I think that the key has been setting up the infrastructure to reach out to all of those that you cover, make a priority list and get them in an efficient way. And at the same time that you get them in for the first vaccine, you already make the appointment for the second and get it documented onto the patient's medical chart at the time. And you have to be creative. You have to, public health is a big public health priority here, getting the vaccine out to the maximum number of people. Again, by priority group, to the extent that there's a limited number, and to the extent that there's limited time and resources, you have to prioritize getting it to the highest risk groups first, but then ultimately getting it to all eligible. We're vaccinating here 7 days a week. There's no
Even on Shabbat.
Even on Shabbat, the vaccination stations are filled on Shabbat. Get it in as quickly and effectively and efficiently as you can.
Yeah, because what's happening here is we're seeing a lot of people who are saying, I've spoken to somebody last night who said, my mother is 85 living in an independent living facility and she get vaccinated, and yet we're hearing in Israel they're authorizing people as young as 16 to get the vaccine. Right. So we see this binary view. I'm talking within the American Jewish community, and people are, while they're very proud of what's going on, they're having this difficulty in understanding. So I thank you for clearing some of that out.
I just want to add one thing about that, since you mentioned assisted living facilities. I think that one of Israel's successes here has been, it's been very clear around the world.
And independent, by the way, independent living facilities are in this like no man's land that we're trying to figure out, right?
Right, of course. But the group living facilities, nursing homes, and assisted living, where there's a lot of interaction among the residents and the staff, they've been places where the virus can spread like wildfire in a population that is high risk with devastating outcomes. And we saw that here, and I know you've seen it in the States. And we, early on in the pandemic response, designated a special priority task force team to deal with these facilities and to swab and test and isolate and quarantine the people who need it at these facilities. So when the vaccine rollout came along, they were also done as facilities. Nursing homes, assisted living facilities are not going in each one to their own health fund, on one on Tuesday, one on Wednesday, one on Thursday, but the state has come in and organized, okay, on Monday of this week, nursing home X is going to be vaccinated, and they come and they sweep and they do the whole facility, and all of the staff and all the foreign caretakers who live there, they're all vaccinated. And then 3 weeks later, they come back and do it again. And it's been such a priority that even though we said that in the general public, those who've been ill before aren't vaccinated, in the facilities, even if you've been ill before, you're still vaccinated. They're not going to sort of fine tune and say, okay, you had it before in August, so you don't need it. Everybody gets it to make sure that we have maximal coverage in these highest risk facilities.
What's the extent of the military's involvement in this?
So the military has been more and less involved at various stages of the pandemic response. Whenever there has been lockdowns, the military has been called in to help. If there's been, at a certain point, there haven't been nationwide lockdowns, but various cities and communities in lockdown. And then when individual public is limited in its ability to move, the military comes in to help facilitate. They've helped out in hospitals. They've helped out in transportation of supplies, and they've been called in, and they've also helped out in the epidemiologic investigations when you have to do contact tracing. So they've had a varied role in the various stages of the pandemic response.
Okay, I'm going to combine two questions. Can you give us an update on the Israeli vaccine that is in production? And two, can you discuss anything about the two different questions? One is about what's the status of the Israeli vaccine in its current trial stages, and also is there any concerns about the privacy information? Are there any privacy concerns considering Israel is providing with Pfizer with a lot of information as allowing themselves to be sort of a worldwide test case for the administration of the vaccine? So the two questions, the Israeli vaccine and Israeli privacy.
So as you say, the Israeli vaccine is still in development by the Biologic Institute. The Prime Minister earmarked it as a high priority very early on in the pandemic response. It's still in the development phase, and there's still ongoing trials. It's updated on the national registry. You can sort of follow along where it's at. It's a different technology than the Pfizer and Moderna vaccines. It's a vector virus for those who follow the different technologies out there. But it's not ready. It's not at the moment ready for even to be submitted for approval. It's still earlier on in the game. So what I understand, it's successful. I'm not involved in the virus research, but from what I understand, it is successfully coming along in the investigative process, but it's not yet ready to be submitted for approval. But I don't think it's going to be superfluous. I think any successful vaccine, even something that is only going to be months or maybe more for being approved, any vaccine for coronavirus that is safe and effective will be a benefit to the world's population, because as we've all seen, this virus is with us now, and safe and effective vaccines are something that the world is going to want to have in its arsenal, and the more the better. To the question about privacy. So I'm notified about this by what's in the public domain, as I imagine others are as well. From what I understand, the agreements that were made between the government of Israel and Pfizer are for aggregative data, not individual patient level data, and certainly nothing that is identifiable. I don't think any citizen has to worry about his or her personal medical records becoming available to an outside source. But when you vaccinate a population at large, you generate data in such numbers that it does a service to the scientific community, to the world community, to be able to learn from data in those numbers. And there are ways of making the data, analyzing the data, learning from the data without compromising privacy. All that I have read has assured me that these safeguards are in place. And I'm actually encouraged by the thought that the data that's generated by the Israel vaccine rollout will be of service to the world at large.
Well, people are loving your presentation. The questions are flooding in. We're going to have to call you Dr. Mitch Schwaber Fauci at at some point, because you're going to have your fan club after this call. People want to see your presentation. They want one quick question that's coming up: Israel and therapeutics. We're inoculating. Where are we in terms of treating people before it actually gets to the point where they get sick?
So yeah, these are very good questions. And unfortunately, there have been a lot of false starts with therapeutics for this illness. There hasn't, the bottom line is there hasn't been anything great pharmacologically. That doesn't mean there's been nothing. There have been, the initial false starts with the hydroxychloroquine, azithromycin, those didn't pan out. But there have been some positive developments in terms of research that's been done and proof of efficacy of a certain number of medications, including antibody-based therapies and steroids, dexamethasone, and others at various stages of the illness. Some early on, some for severely ill, hospitalized patients. A lot of what we've learned is non-pharmacologic supportive care, how to improve patients' oxygenation, how to improve their chances of survival just by the type of care that you give them in the hospital, how to position them, when to ventilate, when you don't have to invasively ventilate, but you can support their oxygenation in non-invasive ways. So Israel has been and is actively participating in research along those lines, and is also very attentive to what's out there in the scientific community literature. And the literature is being widely generated and is available so early on in the process now. When there's good data out there, it's being made available online even before the peer review process, even before it's actually published in a medical journal after peer review and acceptance, just so that people, providers and scientists can get a look at the raw data and see, and the raw data and analyzed by the investigators and see, okay, this is what they found, and draw our own conclusions about it before it actually even makes it into press.
Question, can you transmit the virus after you've been inoculated twice?
Also an excellent question. What the big studies have shown, what their first and primary endpoint is your chances of getting sick, clinically ill with the coronavirus after being fully vaccinated. In the case of Pfizer, it's 1 week, 1 month, 4 weeks after you start, because you get at time 0, you get the first dose. At 3 weeks in, at day 21, you get the second dose, and 1 week later, you're considered fully vaccinated. With Moderna, it's time 0 for the first dose, day 28 for the second dose, and 2 weeks later, 14 days later, you're considered fully vaccinated. So when we talk about 95% efficacy for Pfizer, 94+% efficacy for Moderna, what we mean is that beyond that, for several weeks to months after, you are protected against getting ill. And that's the biggest priority. They did not go into what is your likelihood of being an asymptomatic carrier of the virus. And right. As an asymptomatic carrier, it means you can also get it and you can also potentially transmit it. Now, there's reason for optimism that the vaccine does offer protection against getting it and against transmitting it, but we don't have those data yet. We have seen cases of asymptomatic acquisition of the virus, even in those fully vaccinated, and in some cases, symptomatic. As I say, it's not 100% effective. 95% is still not 100%. So therefore, there's a number of reasons that we have to continue to follow public health and safety guidelines, even when we're fully vaccinated. We still can't take our masks off when we're out with other people. We still have to obey hygiene, distancing, ventilation, crowd control guidelines, partly because not everybody is yet vaccinated, and partly because the vaccine isn't 100% effective, and partly because we don't yet have the data on exactly how effective it is at preventing asymptomatic acquisition and transmission of the virus.
One more point there. Do we know how? And this is about a lot of questions that I'm getting about when does Israel open up and we can take our masks off. Do we know how long the vaccine is going to be good for? I mean, are we seeing that we're going to have to start taking an annual COVID vaccination? Is it going to become like the flu? We're going to have to take it every year, or is this a lifetime shot? Do we have any preliminary data on that? When, and of course everybody wants to know when they can open up the airport and American Jews when they can start flying back to Israel.
Right. So I mean, there are two elements that are going to inform the answer to that. One is, does the immunity that the vaccine provides to the virus that it's protecting against now, does it wane over time? And we're only going to know that with time. There's reason for optimism that even many weeks out, there's still circulating antibodies. So that gives a reason for optimism, but we're still relatively new into this, so it's going to take time to know over time. The second element that is going to inform that decision of whether we need more vaccines and how long it's going to be effective is what's going to be with the new mutant strains and the new variants, and how effective are the current vaccines going to be as new mutants invariably make their way into the virus population. And that's an open question as well. But the good news is that for the main variants circulating so far, the vaccine does seem to be effective. And the other bit of good news is that the mRNA technology, because it's not based on needing to grow a virus, it's neither a live virus nor a dead virus, it's relatively quick and easy to adapt the vaccine to new variants as new variants spread. So
why is that?
That's sort of based on the technology. A lot of the rate limiting step in vaccine development, because you have to grow the virus in the lab, and that takes time. With this is mRNA. It's nucleic material. It's nucleic acids. There's no live or dead virus here. You don't have to grow anything. So really, it's just doing chemistry. And so when you study the new variant, if there's evidence to suggest that the vaccine as it's currently designed is not going to be maximally effective against a new mutant that may emerge, you can, by sequencing the new mutant, tweak the vaccine to make it effective against the new mutant, and then potentially give a booster dose at some point down the road to the population to cover against new mutants that may have made their way into the population. So there's a lot of challenges, but there's also a lot of reason for optimism.
So, we have about 4 minutes left, and I want to thank you for being so gracious with your time. And I'd like to ask you sort of like a personal question. What do you think is going to be the strongest memories of this time in the Israeli public, and the long-lasting effect of this pandemic on our daily lives? How do you look at it personally, professionally? Again, the strongest memories that'll be seared into the minds and hearts of Israelis, or maybe you as a physician. And what do you think the impact is going to be on our daily lives? Are in 2 years from now, are we still going to be afraid to go to a movie and things like that?
Yeah, I mean, again, what's on the mind of this audience is on the mind of everybody. I think is dealing with this virus. If there's one thing I've learned from dealing with this in the past year, it's be very careful about the predictions that you make, because you only know so much. A
little humility is required, right?
Exactly. Excellent word. I have to say, I was thinking about reflecting on this question, and I was privileged to know 3 of my 4 grandparents into adulthood. I have one grandmother who died when I was a young boy, but I knew 3 of my 4 grandparents into my adulthood, and I was very close with them, and I spoke with them extensively about their lives experiences, and they were all born at the turn of the century, and we talked about the Great Depression, and we talked about the war, and we talked about the Holocaust. They all lived through, as young adults, teenagers and young adults, the Spanish flu of 1918, the global influenza pandemic. That had lasted over 2 years. It had 4 waves, and it by some estimates was responsible for 50 million or more deaths.
Worldwide.
I would have thought, based on what we're talking about now, about the coronavirus as something that we're going to remember forever, and I suspect that's true, but I don't remember having a single conversation with my grandparents about their experiences in the Spanish flu. I don't even know if I knew about the Spanish flu at the time. And it just made me think, you know what, if that wasn't part of our discussion, then the world went on. The world, and now when we look back and we see pictures of the Spanish flu, we see people walking around with masks on. But we clearly didn't grow up that way in the United States. So, these are pictures from 1918, 1919, 1920 of the United States people in masks.
And you see the pictures of classrooms literally being held in New York City outside.
Yeah.
Kids were outside with blackboards, and you see how even then they knew you should be in not in a constrained environment, but in a place that was open air.
Right. So exactly. So what I'm saying is, people have a way of moving on and moving past even very, very major, searing, sometimes traumatic events. So I don't know. I would like to think that what we're going to take from this is a sense of, first of all, how important it is to join hands and, join elbows, as the case may be, but in helping out those who are in need, whether it's an immediate neighbor, whether it's an elderly person who is afraid to go out, whether it's a family member, whether it's patients, in your frame of circulation, we're lending a hand in help in times of trouble. And the other lesson that I would hope we would take with us is, as you said, humility. When we started out with this virus, first of all, we were in a position where we thought we really had the world cased. We knew everything. We were in a global world and we could really conquer everything. And then this tiny virus that's measured in nanometers comes and it sends the whole world packing, going home. And it closes down the skies and it closes down the country. And we think we understand that it causes a pneumonia, but then it quickly turns out to be not just an average pneumonia, it's a whopping pneumonia in some cases. And then it's not just limited to the lungs, it can affect other people, other organs and other systems as well. We think we have therapeutics, and then those therapeutics turn into not being so great. We then develop a vaccine, and we think that the vaccine is really good, that's going to be the end game. And then the new mutants come in, the new variants come in, and we see that we're really still in this. When I first got my vaccine, I got my first dose of vaccine, I'll close with this, we were encouraged to put on social media pictures to encourage people, see their doctor getting vaccinated, that'll encourage people to come out. And I was reminded of a quote from Winston Churchill in 1942, when the Allied forces defeated the Germans in Egypt and prevented the overrunning of the Holy Land. And he spoke in London in November 42, and he said, it's not the end. It's not even the beginning of the end. It is perhaps the end of the beginning. I thought that was an appropriate quote, but someone took me to task. One of my friends took me to task on Facebook, said, why would you call this the end of the beginning? Don't you even think it's at least the beginning of the end? And in that month that has passed, since a little bit more than a month, we've seen the new third wave really not coming down to the way we expected and we hoped. We've seen the new variants coming in and taking hold. We've seen that this virus is not done with us yet. So I think that a huge measure of humility is warranted. I don't mean to discourage. I just think that we have a lot of challenges. We don't know everything, and what I hope we'll take from this is that we're not masters of this planet. We're guests here. We're given a lot of tools. We're blessed with a lot of, we have a job to do, and we're blessed with a lot of tools that we have to figure out how to optimally use them. But ultimately, we're not the masters of the planet. We're guests on the planet. And I would hope that would be something that we would take with us going forward.
Dr. Schwaber, we can't thank you enough for your just extraordinary presentation. It was not only just fact-filled and clear, but also hopeful and simultaneously informative. And at the same time, of course, as members of the American Jewish community, we're proud that our brethren across the country are having having great success. And yesher koach to you and to everybody else who's working on this. And may God continue to bless your efforts to bring good health to the people of Israel. Thank you. To everybody out there who joined us, we want to thank you for joining us for this webinar. We will continue to bring webinars of interest to the American Jewish community, and we thank you for joining us here today. Good afternoon.
Shalom.
Litraot.